Hey guys, so I had kind of a funny experience the other day. I was in an intubated patient's room and I was talking to them as I was doing everything. I was telling them, that I was going to give them a breathing treatment. I let them know when I was listening to their breath sounds. I was talking to them about suctioning and that I was going to start doing that. And somebody came in behind me and they're like, "Oh, that's so nice that you talk to your intubated patients." And I remember thinking, well, I talk to all my patients, but I guess not everybody does. So I thought I would make a short little video on why I talk to all of my intubated patients and why I also talk to all of my patients that have trachs or an artificial airway that's helping them breathe through their throat because they can no longer breathe by themselves. It sounds like common sense, but I'll get into a little bit of why it may not be for other people in the healthcare field. So just quickly, my name's Amy. I'm a registered respiratory therapist, and that basically means that I deal with everything cardiopulmonary, heart, lungs, anything that involves those systems. That's my specialized area, which means anytime someone cannot breathe by themselves, I'm going to be part of that care team, because if you are not breathing correctly, it's going to make everything else much more difficult, of course. So first things first, let's talk about patients that are intubated, the tube that goes in their mouth and helps them breathe through a mechanical ventilator on life support. A lot of times when this occurs, I talk to every patient in the process of intubation, after they've already been intubated during that time that we are caring for them, and then of course up until after they're extubated. And when we do the intubation process and after, there's often medication involved for sedation and analgesics, things that are going to help them calm down and relax, and things that are going to take away the discomfort and pain, because as you can imagine, having a plastic tube in your throat is going to be very uncomfortable. Let's think about some of the things that we do when someone is intubated. Obviously, doing oral care, brushing their teeth. They're going to be suctioning, which is when a catheter is placed through that tube to help move secretions and mucus from the airway, because you can obviously no longer do that yourself if you have a tube in your throat and helping ventilate your lungs. And sometimes that's even the reason that we have to put that tube there, because someone cannot clear those secretions or that mucus by themselves. And that obviously is not a comfortable feeling, having a tube in your throat and then having a smaller tube placed through it and using a suction to remove those secretions. It's actually quite painful. It's been rated one of the most painful things that people remember when they have been intubated. And on top of those things, just day-to-day activities when patients are getting bathed, because obviously patients are going to get bathed when they're in the hospital for days at a time. They're going to get moved up in the bed or boosted. Maybe they have shots they're going to be given. There's even like neurological assessments that nurses and RTs will check. You will check the size of your pupils with a flash, like a little tiny flashlight. Can you imagine if no one is talking to you during that process? How scary that could be. Obviously, people have sedation, they have pain medication, and sometimes they're even chemically paralyzed depending on the reason that they were intubated in the first place. A lot of things go into that sedation process, whether it's your own personal metabolism, if you use certain medications before, or some medications just don't work the same for every single person. So something that may sedate me well and take my pain away well may not take somebody else's pain away well enough. There's been various studies and people that have had experiences where they do remember things while they're sedated, or even sometimes when they're supposed to be chemically paralyzed and perhaps some of that sedation or pain medication wears off. So anytime I go into a patient's room, whether I have helped them before or not, especially if they're intubated and sedated, because they can't see me, they can only hear me, generally their eyes are going to be closed. As we try to liberate them from mechanical ventilation, that sedation will be decreased and patients will be more awake and alert. There's various levels of sedation depending on what we're doing. Some patients can sit up and write to you. They will obviously be moving their hands around. It really all depends on why they were intubated, what disease disease process or what injury they have, and the level of sedation, pain medication, or obviously if they are paralyzed. But regardless of what's going on, I will come in, I'll introduce myself, even if I have been in there twice already. I will go in and remind them, hey, it's Amy with respiratory. I'm here to do A, B, and C. Okay, I'm gonna listen to your breath sound, so you're gonna feel my stethoscope on your chest, because that's gonna be pretty scary. Can you imagine no one says anything and you can't see, and all of a sudden you just feel people touching on you or giving you an injection, or even, as I mentioned before, suctioning, inserting that catheter through that tube? That would be terrifying, because you have no idea what's going on because no one's explaining it to you. So I think, especially if someone's not familiar with how patients are sedated, they may enter the room and they're in a hurry and they're like, okay, I'm gonna do this really quick, and I gotta go see my other patient who maybe has something else going on, or somebody's having a medical emergency. Doesn't matter what's going on. I always, hey, my name's Amy, I'm gonna do this really quick. I apologize if I seem like I'm in a rush. I've got to go see another patient. I lay everything out step by step. And I can't tell you how many patients I have had that when they wake up, sometimes they'll recognize my voice, or they will tell me they remember me. I just had a patient the other day that, even though she had quite a bit of pain medication and sedation, when she was intubated, her eyes were open and she was awake and kind of looking around and able to communicate. I got to see them the next day when they were extubated, and I asked, oh, hey, do you remember me? I was taking care of you when you had that tube in your throat. I'm so happy to see that we got rid of it. And she said, yeah, I remember you. You were one of the only people that talked to me. You would come in and you'd swab my mouth every time I was in there. You would, brush my teeth, and that just made things so much easier. Thank you for telling me when you were going to suction me, because I could kind of mentally prepare myself, because even this patient, was telling me, yeah, that's a horrible feeling. And I can imagine how that would be a horrible feeling. Nobody, it's those little things that I think people get caught up in their day-to-day routine, or they're in a rush and they're like, okay, we've done this once, so I don't need to explain it again. No, explain it every time, or even, hey, I'm gonna suction, it's gonna make you cough, remember we did this earlier. And then don't tell them as you're already doing it, because that gives them no time to prepare, and it's really an odd feeling, I'm sure, when you don't really have a say in the matter, because oftentimes patients' hands are restrained so that they can't accidentally pull out tubes and lines, because when you have sedation and pain medication on board, you're not always thinking the best, and removing those things too soon can really hurt yourself. So they really have no say in what you're doing. So it's just a common courtesy, and to kind of give them that minute to regroup and go, okay, I know I'm about to get suction. Let me take a deep breath. I can prepare myself. I know what's about to happen. And honestly, it makes the whole process smoother. You have to talk to people, regardless of if you've told them what's going to happen once or a million times. Never forget that, one, obviously, are people, and you would appreciate being told. And two, you don't know how much exact sedation they have had at that point, or perhaps the previous time, so they might not even remember the last time you were in there. So talk to them every time, tell them what you're gonna do the things that you would appreciate someone doing if you were in their shoes. Now, these same things also go for your patients that have trachs in place, because depending on the reason that they have had that trach, one, obviously they were very likely intubated at some point, and then they had a trach put in place because they could no longer breathe by themselves, whether they are still on a mechanical ventilator with their trach, or if they're on some other modality, or just the trach itself. Even if a person is not fully responsive when I go in to talk to them, I still talk to them the same exact way. I'll talk to them about little things that I've been doing throughout the day, maybe the weather, or if the TV's on, and I really pay attention to the TV. I really pay attention to the TV, because if you have no ability to change the TV yourself, and there is something on TV, like, I don't know, let's say it's on a movie channel and there's a scary movie, and they can't change it, and all they're hearing are the screams, or the scary things that are happening in the movie, or let's say the news is on and it's just really horrible stuff that they're talking about. There's various channels at some hospitals that are music, or maybe even just changing it to something that's a little bit lighter, because you don't know what's going on in somebody else's head, especially if they don't have their eyes open. And it's kind of like when you fall asleep watching a scary movie and you start having a bad dream because you're hearing the scary movie in the background while you're sleeping. Imagine that, but 24 hours a day. So I try to pay attention to these little things. And then obviously, let's say, for example, as an RT, I have my assigned areas, but sometimes I get called for emergencies if another RT is not available or they're stuck doing something else. We are expected to walk in a room and maybe not necessarily know everything about the patient, but still be able to resolve a problem. I've had patients that have progressed quite far in the ALS disease process. So although they are not able to move or communicate, they are still 100% aware of what's going on around them, of course. So you should never assume what someone can or cannot understand. Keep talking to them. I have had a specific patient that was very unresponsive when you would talk to them, and I always talk to them. And one day I came in and I told them, hi, Mr. blah, 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 we're gonna do this like we usually do. I just wanna give you a heads up. I'm getting ready. I'm putting my stuff together so we can do your chest physiotherapy. And he looked at me, and over his trach, obviously you can't talk very well with a trach or with the balloon inflated, but they can still kind of force air out and they can still kind of mouth words, obviously. He looked at me and said, okay, and the nurse was in the room, and I looked at the nurse and she looked at me, and we're both like, oh, he responded, because he had never responded before. And the same patient, I had an incident later where they fully lifted their arm up and waved at me when I entered the room and mouthed something about wanting something to eat, and then I have not heard them say anything or move around like that since. And I don't know if they responded like that because I always talk to them or what it was, but they made eye contact, got enough force up to lift their arm up and wave at me and smile, and then that was it. So never, ever, ever stop talking to your patients, even if you're in a hurry, if there's an emergency especially, because oftentimes in healthcare, if there's an emergency, we just get into go mode. We are trying to do what we can to help that patient, but remember, they are still there, whether they are talking to you or not. Give them those words of encouragement. Let them know that you see them and that you're there to help them, and never stop talking to them. I have so many stories, and I've only been doing this for 2 years. Maybe it's a unique experience as a respiratory therapist to have so many of these stories, because many of our patients are intubated or have artificial airways, and we are always there during, emergency situations, because emergency situations and critical care are kind of our bread and butter as respiratory therapists, since we deal with the cardiopulmonary system. But never, ever, ever stop talking to your patients. I know that I would not want someone to do anything without telling me what they were doing, and I'm sure other people don't, regardless of if we think they can hear us or understand us or are sedated or paralyzed. Just do what you would like someone else to do for you. I don't know. Anyways, that kind of turned into a long rant. I'm sorry, guys. But if you have any questions or similar stories, leave them in the comments down below. Don't forget to like, share, subscribe. If you guys have questions, comments, concerns, any suggestions for future videos, feel free to either message me, comment, or again, you can always find me on Instagram at breatheeasy_RRT, and I will see you guys next time.